So, I'm going to read a little bit about Debbie. So Debbie graduated with her BSN in 1981. She started as a peds nurse at UHC in 1982 before she moved to New Hampshire in 1985. From 1986 to 2010, she was in various roles as a staff nurse, care coordinator, and nurse manager. She also ran a daycare, worked at a marketing firm, and a publication company. Debbie has now returned and has been a nurse on 4J and UHC for almost 9 years. She's a true leader on 4J and has a heart of gold. She has a drive and passion for providing the most compassionate and attentive care to her patients and families, along with being a strong patient advocate. She does an outstanding job of educating her patients and families. She really takes time to listen to their questions and concerns. She's an active member of the STAR Committee and participates in the quarterly surveys on 4J. She's a resource for the unit for what skincare products our staff should be using. She's active on the Falls Committee and presented her motivational interviewing project at ONS Congress, Magnet Conference, and the EVP Conference. She's worked with Dr. Sharon Tucker to write a chapter in a book regarding her motivational interviewing to help decrease falls. She's been instrumental in publishing 2 nursing articles related to decreasing falls. She was named one of 100 great nurses in Iowa in 2018. She's maintained her OCN and MedCert certification. She is also a phenomenal preceptor for nurses and nursing students. She picks up extra shifts on the unit, which helps our staffing needs, and also functions in the charge nurse role. She's very involved outside of work in various functions and activities, including the American Cancer Society Relay for Life, where she's been our team captain. And she's an active member and our current president of the Eastern Iowa chapter of Oncology Nursing. She's always willing to help anyone and has truly made a difference in so many people's lives.
Nope, you're fine. Nope.
So Debbie, I'm going to give a little history. I feel like I should stand on stage. Like that, since Kelly came out here. So in late 1999, at the age of 33, Patrick Barnes awoke with some blood blisters in his mouth. Having survived Hodgkin's disease twice, he was admitted to the hospital and diagnosed with ITP, which all of you are very well aware of on this floor. Pat and his wife Tina had just had their first child just 2 months prior to his diagnosis. And he did end up succumbing to his disease, but his family was so blessed to have the experience that they did with the nursing staff where he was located. So during those weeks of his hospitalization, they experienced the best of nursing. They were there to see that they knew that they would see clinical skill that dealt with his very complex medical situation, the fast thinking of nurses who saved his life more than once, and that nursing excellence took years to hone to the best of the profession. But what they did not expect was the kindness and compassion that the nursing staff gave to Patrick. They were in awe by the way the nurses touched him and spoke with him, even when he was on a ventilator and totally sedated. The way they informed and educated the family would ease their minds, and they truly were helped through the darkest days of their lives with their soft voices of hope and strong, loving hugs to this day. So you exemplify what a Daisy nurse is to the Barnes family. So thank you.
Wow. All right, Debbie, I'm trying to get through this. So, I would like to nominate Debbie Shikosami for the Daisy Award. She is a nurse who truly displays extraordinary compassion and specialized clinical knowledge. Debbie needs to be recognized as she is an outstanding patient advocate and role model to our staff, patients, and families. During bedside report, Debbie noticed something was not right with her patient. She acted on this intuition and began her focused, thorough assessment right away. Debbie had taken care of this patient the day beforehand, and on this morning, he did not seem himself. Debbie immediately noted he had no left-sided lung sounds. This patient has had a significant amount of chest tubes placed, and removed yet again, most recently days before this particular morning. The patient had poor circulation, so it was hard to get oxygen saturation, but the nursing assistant was able to get a brief reading of 76% and reported this to Debbie. Debbie then called a rapid response as he was very short of breath, working very hard to breathe, unable to get an accurate oxygenation level. He had no left-sided lung sounds, and he had developed a new cough, which you knew can be a sign that his left lung had collapsed again. If it weren't for Debbie's immediate attention, persistence, knowledge, and advocacy on behalf of Michael, who was a very sick patient, he would not have been transferred to a higher level of care, as he needed a higher level of attention and medical intervention. Debbie is an amazing nurse who deserves to be recognized for extraordinary care. Not only did she advocate and save this patient from having an emergent event happen on 4J, she also displayed such compassion while caring for him, not only on this very morning, but days prior. He was admitted on 4J for 48 days, and the day before this event, Michael told Debbie she was the first person to be so gentle with him and thanked her for being so mindful of his pain, while caring for him as he had so much pain in his legs, feet, and hands due to his very poor circulation in combination with his cancer medication, making his extremities extremely cool, hypersensitive, and painful. Debbie's strong oncology knowledge helped her to fully understand Michael's pain he was having in relation to his cancer, so she knew to be extra cautious and knew exactly how to care for his cold hands, feet, and legs. She advocated relentlessly for his comfort and to act on his acute clinical issues to the physician days prior to this morning. Debbie's compassion and knowledgeable expertise was very clearly demonstrated for this patient. Michael greatly benefited from her compassion, kindness, tender care, and her knowledge in the last days of his life. I wanted to recognize Debbie for making a huge difference in impacting his life. So, congratulations. Yes, it was.
Congratulations. Thank you. We have a few gifts for you. So much for here. These are your daisies. For you, we have a special daisy pin you can wear. This is your nomination. It's ready for you to have. Something praying for you. Here's the Cinnabons or the cinnamon rolls that Patrick loves so well. Enjoy. And most importantly, here's the statue, Healing Touch. This is made by the folks in Zimbabwe who the Barneses were able to have them make these on a regular basis, which helps their economy. A very politically unrest country. It really has helped economically. And so this is for you. Thank you. Very much. And I'm not going to say your last name because I had to announce it at the 100 Great Nurses in front of everybody, and I kept practicing it all the way there, and then I got it right. But I'm not going to say it again. Thank you very much. So,
And we're going to take some pictures of before the team goes away.